Today at the State House, Governor Patrick signed a bill that aims to put the brakes on the rising cost of health care in Massachusetts. The new law would allow the state to set limits on cost increases by health care providers. There would also be new incentives for providers and consumers to hold the line on spending.
Through a series of tools ranging from enabling new care delivery models to capping the rates of overall cost growth to medical malpractice reform, this bill will result in nearly $200 billion in health care cost savings over the next 15 years. Massachusetts has been a model to the nation for access to health care. Today, we become the first to crack the code on cost.
The establishment of a health care cost growth benchmark will mean that the costs that are already going down will go down even further.
We're incentivizing keeping us healthy and investing in our overall health. Patients and consumers in Massachusetts will see a decline in healthcare costs and their out-of-pocket spending as we incentivize having coordinated care. So our providers are talking to one another. We'll have more time with each of them. We also are investing in public health, which will make a significant difference with the Public Health Trust. There's no other state in the country that has made this sort of investment in proven effective programming at the community and local level.
This bill is really a groundbreaking moment because what it focuses on is the importance of reducing the growth of costs of health care while at the same time promoting improved quality and from my perspective as a public health person, it also supports the idea of prevention, encouraging wellness among the population as one of those many tools that it uses to try to reduce the costs over the next several years.
Many of our folks have been literally choosing not to get the care that they need. Unfortunately, that means you're not getting the preventative work, you're not getting the emergency care that you might need. This bill really addresses that.
Going forward, we're going to continue to work together to make sure that every person in the Commonwealth, every family, every child, every senior who needs the kind of quality health care that they should be getting is going to have a much better chance of getting it, and that's what this bill is about.
Meanwhile, the Pioneer Institute says a better way to control costs would be to give consumers and insurers more leverage instead of expanding regulation by the state.